everybody, in this video we will speak about one of my cases. This is a case of a 35 years old woman. And the case started by a phone call of my another patient who asked for help for her daughter who collapsed, and she needs an urgent help. We discussed a little bit about sending her directly to a psychiatric department, but then I agreed to speak with her and then decide. What was first surprising for me was an observation that she smiled when she came. So there was a big difference between what I was told and how she looked. So I noted acrimony as a remedy that masks suffering behind a smile. So the first question was quite simple. I use it frequently. How can I help you? It's an open question that opens all the possibilities, all the options for the patient. And she started to cry immediately. I feel so tired. I cannot bear it anymore. I have no strength. So even from these two sentences or three, I noted Olive for being very tired, Sweet Chestnut because she can't bear it anymore, and Hornbeam for a lack of strength. Just suggestions, but maybe later we will consider them. I'm alone with my children at home. My husband works as a sales representative and he is away from home most of the time. Even during weekends, his clients call him and he is ready to help them. So she takes care of the whole household and children, and it sounds a little bit like Centauri. It's too much for you. It's a simple reflection, just repeating, summarizing what she has told. He loves us and wants the best for us, but there is a lot of competition in his branch and he has a fear that he could lose his clients. We plan to build a new house, so we need money. He loves you and he must take care of his clients. This is so-called two-sided reflection. On one hand, she tells that her husband is loving, but at the same time she complains that he doesn't have enough time for his family. Yes, and yesterday evening he came home and couldn't bear it, and I couldn't bear it anymore. So again, this feeling of the exceeding of limits. So Sweet Chestnut, maybe. Seems quite probable. I started to cry and told him many bad things. So she lost self-control, it sounds like Cherry Plum, and she maybe feels guilty because of that. You did not maintain self-control and you feel guilty because of that. So this reflection tries to go a little bit deeper to explore her feelings, whether she really feels guilty because of that. No, not really. It's more I have a fear that it can endanger our family. So it's more Mimulus than pine. Your family is very important for you. This is a reflection, but at the same time it is an affirmation. You tell her that you appreciate her as a good wife and mother, because family is on the first place for her. And she cried again. I have already been at home for 5 years and it has been quite okay. But then I have got coronavirus and then I could not recover. I have been so exhausted and I am still exhausted. So again, it sounds like Olive. And at this moment she started to smile, and it was quite strange to when she spoken about serious things and she smiled. So you speak about serious things and you smile. It's a reflection that tries to uncover what is behind this discrepancy. Yes, I usually try to maintain self-control. People who know me say that I always seem happy. So she's trying to keep a mask to control herself. It's cherry plum, and to seem as if nothing happened. It's agrimony. And what do you do when you have no energy? An open question. Uh, I usually hold on even when I'm very tired. And you must deal with everything alone. Nobody can help you. This is a so-called amplified reflection. We intensify or overshoot what she has told to provoke her, to invite her to react in an opposite direction or explore whether it is true or not. I could ask my husband for help, but he is also tired after work in the evening. He wants to relax and he reacts abruptly when I ask him for something. Again, she keeps her emotions inside. Agrimony. You do not like conflicts. This is a reflection that tries to explore the agrimony theme that seems quite central in her. No, I try to avoid them whenever possible. Again, confirming agrimony. So, let's go through what the ideas are and agrimony. Sweet chestnut, olive, certainly for exhaustion, hornbeam maybe for weakness, cherry plum for fear of losing self-control, mimulus for fear of endangering family, and centauri, difficulty to tell no or doing more than her duty is. And we can still add, it's usually useful to add more essences that do not fit perfectly to the case, but they may also be useful for her, and to see whether, for example, some of these first 7 essences will be excluded. It's necessary to invite her to take part in the process of decision. So, and pine for reproaches of conscience, and gorse for hopelessness. And remember that the number of the essences is limited to 7 essences. So the result is agrimony for oversensitivity to conflicts, sweet chestnut for feeling of being ruined, destroyed, for extreme suffering, olive for total exhaustion, cherry plum to help her to maintain self-control, Mimulus for fear of endangering of the family, Centauri to be able to tell no and to share the work with the husband or with granny. And she herself added gores to boost her hope because she felt already hopeless. And the recommendation was 8 times 4 drops daily, and whenever necessary, she could add another dose. And apart from the treatment bottle, I gave her also a short explanation about the work with the energy. Like energy is like money, and if you have some expenses, you need also to have some income and so on. And 1 week later, she came, and she was quite different. She smiled again, but this time her smile was relaxed. I feel much better. In the evening, when my husband came home, I told him everything about my feelings. It was like a dam that broke through. What surprised me, he told me that he was really worried about my health and he would like to help me. So we found a compromise. One evening is for me, and on Sunday my husband switches off the phone. So now we can still tell something about techniques that were used in the case taking. The most frequently used technique is reflection, so just repeating what the patient has told, and in simple reflections it's only telling with the patient's words or with different words the similar thing. But complex reflections go deeper, and we can, for example, use them to verify underlying emotions or explore the discrepancy between her face expression, for example, and words. We can amplify some statement to provoke her to some reaction, or we may test corresponding remedy. And I also used open questions that help to explore the themes in detail, but at the same time they support patients' spontaneous speech that is crucial for the right assessment. And affirmations that help to improve therapeutic relationship. The patient feels accepted. It gives him a feeling of value. She felt as a valuable wife and mother. And it also supports the patient to make a change. And if you would like to learn more about the techniques used in case taking, please click on the link below the video. So, thank you very much for watching this video. I hope you have enjoyed it. And in the next video we will continue with the case 2 of a 49 years old man, John.